As the largest insurer of physicians for medical professional liability, the Doctors Company is in a unique position to listen to and advocate for doctors. We've asked our 75,000 members about their concerns with the current state of medicine, and in particular about what additional liability risks they see with the progression of the Affordable Care Act, or the ACA. We found that physicians are increasingly concerned about the consequences on healthcare delivery. The ACA and its consequences create a minefield of potential medical liability issues. The major categories of concern will be discussed in this two-part video series. This first video will address the ramifications of quality data reporting and reimbursement limitations. Part 2 of the series will focus on the consequences of electronic medical records and the new managed care liability. Our physician members are concerned that many provisions of the ACA pertaining to reimbursement or reporting on patient satisfaction and outcomes will lead to default standards of care, taking away physicians and other healthcare providers' ability to vary clinical decisions based on judgment and resulting in significant liability exposure. Evidence-based standardization is a huge part of the ACA. The Patient-Centered Outcomes Research Institute, or PCORI, has been formed to establish evidence-based standards. These are to become reimbursement guidelines. They are not intended to establish a new standard of care, but the fear is that they will. The application of evidence-based practice guidelines will increase suit opportunities 6 to 8 times what it is now, according to some observers. Let me explain that the legal standard of care for medical professional liability claims recognizes variation in situation, judgment, and outcome. It is essentially the level of care that an ordinary prudent professional having the same training would provide under the same or similar circumstances. It is not standardized practices or even optimal outcomes. Patients, however, are expected to rely on this data in making their judgments about the quality of care they received. If the federal government says you shouldn't have been readmitted to the hospital and you were, you may seek compensation. Medicare actions aggressively pursuing practitioners in recovering payments for what the CMS deems as non-evidence-based care may also prompt plaintiffs to file suit claiming unnecessary care, usually unnecessary procedures. Healthcare industry experts believe that allegations arising from payment denials will be the next big problem in medical liability, resulting in multiple claims against individual providers or groups. Reimbursement guidelines creating their own standards and outcome expectations expose every doctor to more risk.